Okay, now miscarriage. Miscarriage is defined as the spontaneous expulsion of products of conception before 24th week of gestation. Before 24th week of gestation, expulsion of the products of conception occurs. That term is known as miscarriage. Now, two types of the miscarriage are there. First is early trimester, first trimester miscarriage, and another is late and second trimester miscarriage. First trimester miscarriage is less than 12 week of gestation, while in second trimester of miscarriage it occurs between 12 to 24 week of gestation. These are two types of miscarriage. Risk factors of miscarriage are chromosomal abnormalities. Most common cause of early pregnancy miscarriage are chromosomal abnormalities. Are trisomy is the most common cause of miscarriage. Another are structural abnormalities like uterine septa, Asherman syndrome, endocrine defects like diabetes mellitus, hypothyroidism, polycystic ovarian syndrome, genital tract infection, cervical incompetency, and immunological diseases like antiphospholipid syndrome, SLE, and these are the common cause of the miscarriage. Now, early pregnancy miscarriage is a type of miscarriage in which there is inadequate placentation occurs and defective transformation of spiral arteries, reduced trophoblastic penetration into decidia, inadequate placentation occurs in the chromosomal abnormalities. So these are pathophysiology of early miscarriage, early pregnancy miscarriage. Another type is late pregnancy miscarriage, in which there is intrauterine bleeding is compromised. Intrauterine infection can be there in abnormal uterine cavity which have fibroids and congenital anomaly may develop late pregnancy miscarriage. Okay, so cervical weakness, which may be congenital or acquired, and over distended uterus, which may be because of multiple gestation, or in polyhydramnios, late pregnancy miscarriage occurs. So these are the causes of miscarriage, in which polyhydramnios means excessive amniotic fluid causing expulsion of the fetus, that is late pregnancy miscarriage. Now, clinical features and the classification of the miscarriages. There are different types of the miscarriage like threatened abortion, inevitable abortion, incomplete, complete, missed, and septic abortion. These are six types of miscarriage. Now, the classification is based on the clinical features and ultrasounding finding. Vaginal bleeding is the most common symptom in all type of the miscarriage. Means all type of miscarriage will present with the complaint of vaginal bleeding, abnormal vaginal bleeding during pregnancy. Threatened miscarriage is a type of miscarriage which is diagnosed by vaginal bleeding and a cervical os is closed, and pelvic ultrasound will show fetal heart sound will be there in threatened miscarriage, and its supportive features are uterine size corresponding to the gestational age, normal HCG will be there, and investigations will be complete blood count and RH. CBC and RH will be investigation of the choice. Urinalysis, pelvic, cervico-vaginal swab, pelvic ultrasound. These are the investigation of the choice for threatened miscarriage. Management will be supportive management and repeat ultrasound. Anti-DRH antibody should be given. Research to the negative woman. And another type of the miscarriage is inevitable miscarriage. Now, this is miscarriage with irreversible condition characterized by the vaginal bleeding, uterine cramping leading to cervical dilation, but no passage of products of the conception, and waste or loss of fetus or conception, that is known as inevitable miscarriage, in which vaginal bleeding occurs with cervical os is opened, that is inevitable miscarriage. Pelvic ultrasound will show intrauterine pregnancy with no fetal heart sound and no passage of the tissues because there is death and the conception occurs, and management will be by misoprostol, vaginal sublingual, and surgical management by dilation and evacuation is done. And another is incomplete miscarriage. Incomplete miscarriage is a type of miscarriage in their vaginal bleeding with uterine cramping leading to dilation and passage of some but not all products of conception. It is diagnosed by vaginal bleeding, cervical os is open, ultrasound will show they retained products of conception. That is why it is known as incomplete miscarriage. Yes, passage of the tissue will be there with rupture of membrane will be there. Now it is managed by supportive treatment by misoprostol and prostaglandin analog, vaginally or sublingual, surgically by dilation and evacuation, because there is incomplete loss of products of conception has happened. And the another type is complete miscarriage, which has also vaginal bleeding with cervical os is closed, and pelvic ultrasound shows that there is empty uterus because products of conception has been removed and expelled out. That's why this is known as complete miscarriage. Now the another type is missed miscarriage, in which gestational sac containing dead embryo, dead fetus, and uh, there will be symptom of expulsion. Asymptomatic condition, it shows these are cervical os is closed. Ultrasound shows intrauterine pregnancy with no fetal heart sound. So in this way, this type of miscarriage presents. Treatment will be medical treatment with anti-D antibodies, and management will be misoprostol sublingual, and dilation evacuation is the treatment of the choice for this type of miscarriage. Now, clinical parts are recurrent miscarriage means consecutive more than three recurrent pregnancy losses. It affects 1% of the couple, and irrespective of the advanced maternal age means those women who have larger age in the maternal age, and obesity. Obese women having BMI more than 30 are prone to develop recurrent miscarriage. Balanced chromosomal translocation can be there. Are antiphospholipid antibodies, and aspirin low dose heparin can also predispose to miscarriage. And the last type of the miscarriage is septic abortion. It is septic word indicates the bacterial infection, so it is complication of the abortion in which intrauterine infection occurs, and that infection causing loss of products of conception, and that condition is known as septic abortion. Vaginal discharge will be there, abdominal pain, tachycardia, hemodynamic instability with leukocytosis is there. Cervical tenderness and ultrasound shows retained products of conception because there is septic death of the fetus occurs. And the management will be hemodynamic support with IVF resuscitation, and obtain blood and endometrial culture and give treatment according to that. Prompt dilation and evacuation should be done of uterus after initiation of antibiotics. So in this way these miscarriage occurs. So there were different types of the miscarriage. We discussed about clinical features and causes of miscarriage and its types.